Welcome to Nourishing Conversations with Nicole and Christine. I'm Nicole Rescal, a journalist and certified culinary nutrition expert here in the French Riviera.
And my name is Christine Kilbag. I am a registered nutritional therapist, a Pilates and Extend Bar instructor here in the Riviera.
We created this podcast as a way to showcase the plethora of health and wellness products, people, services that is here within the Côte d'Azur. And we thought we should not only help small businesses get seen and recognition, but also because it's fascinating. We could talk for hours.
We could talk forever about this subject. So do join us on our podcasts.
And let's jump into the episode. Welcome to today's episode of Nourishing Conversations. Today we will be talking about ozone therapy. We have with us Nicky from Riviera Ozone. This is a fabulous place that has very specific special ozone pods that works through transdermal absorption, and she will get into that later. But welcome, Nicky. Thank you for joining us.
Thank you. Thank you for the invitation.
You have offices both in Antibes and Roquefort-les-Pins. People are interested in getting in touch and then getting a treatment. Tell us a little bit about yourself and how you got into ozone therapy.
Okay, so my background originally from the UK was in pharmaceuticals, and along the path, my mother was diagnosed with cancer. And unfortunately, I had too much of an insight into the pharmaceutical way of life, and I ended up deciding to turn my back on that. So I stepped away from pharmaceuticals. Then fast forward until so we're going back a good 5 years now. I was 8 months pregnant with my daughter, and I had a transitory stroke. I actually lost my eyesight for nearly a month. And after that, I had a secondary 9 months later, and I was left with acute hypertension. So at that point, I had my general practitioner throwing lots of pills at me and tablets, trying to regulate my blood pressure, which was being done unsuccessfully at the time. I then made the decision to reach out to two pharmacists that I knew from my old life. And I asked them direct question to both of them individually that if I wanted to try and get off the drugs, what could I be looking at as an alternative? And they both said to me, ozone. So that was where my journey started to find ozone in France.
So it was two pharmacists that recommended it to you?
Yeah, exactly. And I had several pharmacists and scientists who are clients as well, because they obviously understand the effects on the body.
Okay, very interesting. So a lot of people have heard of ozone, but more in the context of global warming, the ozone layer, and things like that. Tell us what ozone is and why it's actually really good for our bodies.
Okay, well, ozone is a derivative of O2. So you've got O2, which is obviously oxygen. O3, which is created by using an O2 molecule, putting a specific frequency of electricity through it, through the second atom. It splits it to make 3 atoms. So you've got O3, which is basically the purest form of oxygen that we can actually utilize. There's nothing above it. Obviously, a lot of people relate it to the ozone layer around our world and the stratosphere. But what we are, in both the clinics, are creating is medical grade ozone that can be used transdermally.
When you say it's transdermal, it's because we cannot breathe it in through our lungs. It is
that's right. Yeah,
toxic
exactly.
to our lungs.
It is. It's an irritant. It's an irritant to the lining of the lungs.
Even though it's oxygen, 3 molecules of oxygen, we can't breathe it. But how does it work well for us? It's into our blood.
It's a good question. So basically, we've got the linings of the lungs are very delicate, and the purest form of oxygen being ozone, it just is an irritant. So this is one of the precautions we have to make when we're administering it to clients in the pod. In terms of what it's doing to the body, it is oxygenating you. It is a soluble oxygen that is being sucked in through your pores, and then it's going into your cells, and then the magic starts happening with the body, because it's basically, it is just giving oxygen to boost your cells to do their job more effectively.
So if it's an irritant to the lungs, are you able to use the ozone therapy if you suffer, for example, with asthma?
Yeah, absolutely. It's what we do is we have a 3-layer precaution. So once you're in the pod, your head is outside and it's very spacious in the pod. You can wiggle around, move your feet and legs, etc. And then what we do is we put a cape, it's a bit like a Batman cape, over your head, which is just fastened around the neck. Obviously, it's not too tight that you're restricted, that you can't breathe. And then we put a towel around over the top of that. And then as a third precaution, we actually put a cannula in your nose, which is pure O2. Because whilst we have you there for 30 minutes and you're having the O3 going in through your skin, it's just another modality that we're giving you to actually breathe the O2, which is obviously a precaution as well, to ensure that if any ozone did seep out, that we've got you secured. It would actually take you to be in a room filled with ozone for it to actually cause damage to your lungs.
Okay.
But we take every precaution to ensure that everyone is, secure in the pod and no ozone is going to get out into the lungs.
Great. And that's a really good explanation. Sorry, because a lot of the research, if people just go onto Google and look up ozone therapy, they're going to see a lot of articles flagging up, avoid ozone therapy if you've got any respiratory problems, blah, blah, blah. But obviously they have not written in about what precautions are being taken. So if we think about respiratory problems, we think about COVID, which is a virus that has been plaguing us for a couple of years. Have you been able to successfully administer ozone with people suffering from respiratory problems, maybe due to long COVID?
Yeah, to be honest, Christine, I've lost count of how many people we've helped, and this started very early on. There was one client who was the worst by far, and to a point he couldn't breathe and talk. He just had to keep catching his breath with every gasp, literally. It was
Severe.
It was very severe. He only lasted 20 minutes in the pod. Normally the session is 30, purely because he had this overwhelming nausea that he'd had for a good month and was having problem even holding water down. Anyway, after the session, because he actually came to the Roquefort clinic, which is my private clinic, so he came here, and afterwards I could actually lay him down. And after I treated the rest of the family, because it's his wife and 3 daughters who came, adult daughters, basically I was treating them, and then they went to get him, and I had my back to the doors, and I suddenly jumped out of my skin because I heard this man's voice for the first time. And I turned around.
He wasn't able to talk before. He was too weak.
No. Exactly. And literally he said, Nicky, and I turned around, I jumped out of my skin, and his color had changed from night to day. He was gray, and suddenly he was flush with color, which is obviously the oxygenation. And he just put both hands together and said, I have no nausea. And his wife literally just jumped on him with tears rolling down her eyes, because just looking at him, he looked like a completely different person. In total, he had only 6 sessions. And on the last one, I stood next to him whilst he was in the pod. We were laughing and joking. And he said, Nicky, I'm stronger than pre-COVID. And that's,
that's great.
Yeah. And that's just one story. There are many.
I can appreciate that, because a lot of the research does show that, in fact, the increase in the white blood cells and the anti-inflammatory cytokines in the body do increase quite remarkably. So fighting infection of any kind, it will have a positive effect.
Exactly, because in the body, it's antiviral, antibacterial, and antifungal. So obviously, COVID being a virus, it is increasing your immune system. So with that elevated, what it's also doing with you, as you know, Christine, with your immune system elevated, you're basically pouring in anti-inflammatory. So it's bringing down your inflammation, which is obviously a major cause of the problems, the secondary problems with COVID. So it's kind of getting it from all angles, because it's the antiviral as well. So yeah, there are many different aspects to it for sure.
Yeah, and I also have looked into it quite a lot with regards to the antioxidant enzymes that are released. So we have some natural antioxidants such as superoxide dismutase and glutathione in our body with the master antioxidant, and it actually does increase the levels of these within the body. And as we know, the liver is responsible for upwards of 500 different processes in the body. So if you can then help stimulate all of this, it's going to help with lots of things, also many other chronic diseases, which you must have also seen in clinic.
Absolutely. I mean, it's actually, this all kind of dates back over 150 years that ozone's being used. The person who really ran with it, seeing the medicinal properties, was Nicola Tesla, because he was very excited that with electricity he could create ozone. He then went on to develop the Tesla Ozone Company and did 2 years of clinical trials and proved efficacy in these clinical trials of 114 different ailments could be either treated, reduced, or completely abolished. So this is going back, you know, this isn't over the last 10 years. This has a lot of history behind it.
Is Nikola Tesla the one who discovered ozone, the O3 molecule?
No, he's not the one who actually discovered it. He's the first one who kind of picked it up and said, 1 minute, there's more to this here. It was actually used during the First World War on the battlefields because there wasn't enough medics. Young boys with canisters would run around. It sounds a little morbid, but the bodies that had been maimed on the battlefield, they would spray ozone over the wounds to stop bacteria growing whilst the medics were getting to them. So yeah,
it can be used topically as well.
Exactly. And even to this present day, all our water that's coming out of our taps and our bottled water has been through ozone, killing off, you know, whether it be pathogens, viruses, bacteria, etc. So yeah.
So I did a little bit of looking up myself with regards to the history of ozone, and it dates back to 1840 by the German chemist Christian Friedrich Schönbein. I don't know if I pronounced that properly. And the name comes from the name comes from ozine, which actually means smelly in Greek. I thought that was quite interesting.
Interesting.
It's funny because the actual smell of ozone, you know, when we have a thunderstorm, a lot of people will comment of, oh, I love that fresh smell. Some of the ozone actually gets forced down. So for that respect, having the ozone coming down to earth, it's actually something that we can relate to. And a lot of clients, I had a new client in this morning, and at the end of the session, she said, what is that smell? And I said, well, that's the remnants of the ozone on your skin. And she's like, I love it. I feel so clean. Exactly that. She's the cleanest she's been in years.
So before we go on any further, I just want to, if you can, Nikki, describe a bit the pod for people who haven't seen it, don't know what it looks like. And since we're podcast, we're going to have to be a bit descriptive.
I'll be as descriptive as I can. It does look a little bit space age. It's basically a pod that's made out of a cast. It's very shiny white. It has 2 very large doors and a seat that you sit in, and you just comfortably sit there. The doors do close around you, which some people do say, and they warn me, I'm feeling, or I might feel claustrophobic, but because the head is out, I've never ever had to cancel or stop a session mid-flow because of that. All it means, if anyone is a little bit more claustrophobic, is that I'm standing next to them instead of sitting in front of a chair in the room chatting with them. And that generally is just, you know, that extra reassurance. But the pod itself is quite ergonomic. But the actual inside of the pod, there are 7 modalities. So we're putting in, for the first few minutes, depending on where you are with your sessions, we're putting in CO2, which has lots of therapeutic properties, but we're using it primarily just to relax the skin and have the pores open. Okay. Then the O3 is going in. Then you've got the O2 that you're breathing in. You've got also essential oil, depending on what ailments or any pain or whatever it might be that I can address on the essential oil side of things. That's going in, being absorbed transdermally as well. You've got far infrared, and you've got ultraviolet irradiation. And lastly, you've got photon light therapy. So you've got 2 lights which are extremely bright when you're in the pod. You can't put your eyes inside the pod because those lights are strobing through 7 different colors and having to penetrate through all the layers of the skin, so your cells underneath can feel this. And this is where
that's amazing. It's amazing that all of that is going on, because when you're in there with your head out, you have no idea what's going on.
You have no idea what's going on. Yeah, exactly. You just think, oh, that was a nice catch up with Nicky.
Nice visit to the sauna.
Yeah, exactly. But it's it's not just the ozone. There are 7 modalities that are taking over a 30-minute period that is starting a chain reaction, and that's very much starting actually with your central nervous system. So I don't know if you want me to explain that kind of pathway.
Most definitely, with the amount of anxiety and mental disorders that are around, I think it's very important.
Mm-hmm. Absolutely. And I'd like to add to that also that I would say 50% of my clients who are reporting mental stresses are men as well. It's not just women. I would say the actual demographic of my clients is 50-50.
Yeah, I've also seen an increase in males in clinic in the last year.
Wow, there you go, which is great to see. It sometimes can be a little bit of a time delay. For example, if the partner or the wife is coming and they think it's something for their beauty regime, but as soon as they go home and start talking about Nicola Tesla, and also with the PEMF machine, which is the 8th modality, which is outside of the pod, and talking about NASA, then the interest is spiked and they want to come and see it, so which is great. So what it starts with is most of us are living on our sympathetic nervous system, which is our fight and flight, and this is our stress receptor, which is designed to be there when we have moments of stress. But unfortunately, with modern day life, a lot of us have been living on it for far too long. So what it's doing is actually starting to, with the photon light therapy and the ozone, it's just starting to relax that down. And like a seesaw, your parasympathetic goes up, which is your calm and digestive state. As soon as that starts going up, it's connected to your immune system. So with your immune system going up and being supported from underneath, obviously we all know the importance of it. But once your immune system is also elevated, it obviously starts helping, if you like, pouring in anti-inflammatory to your system. So it starts to get those niggles and pains under wraps more quickly. Once it then goes into the body, you've got 2 things are happening, because the ozone to a healthy cell is actually obviously oxygenating it. It goes off 4 times faster than when you first got into the pod, because literally your cells are going, I can breathe. Okay, what am I supposed to be doing? Let's get on with this. Rather than, as we know, when your immune system's low, everything in your body is very sluggish and very slow. On the flip side, when ozone comes across, whether it be a pathogen, cancer is unfortunately a major one. I have a lot of cancer patients. And then you've got, as a free radical, you've got obviously virus, bacteria, fungal, also heavy metals. So what they tend to like to do is ferment and multiply. So with the ozone going in, the 3rd molecule of ozone is where the magic is. And that's the molecule that is created with the electricity shock that goes through O2. And what it's doing is actually attaching onto a free radical, and the free radical goes, you're just like me. I'm happy to connect with you because I really don't like that oxygen stuff. So don't bring that anywhere near me. So it connects to the third molecule happily. And then the other two molecules attach onto it, which are the oxygen of the ozone molecules. So that starts oxygenating and starts disrupting the free radical when it doesn't like it. So it starts resonating at a different frequency in the body. This is like putting a spotlight for your immune system to say, this is where you need to be looking. This shouldn't be in here. So it's aiding your immune system. And then because it's being supported, and then what it's doing is a very strong detox. And as I say to all our clients, if you go for a massage and you're told to drink water, most of us kind of have a glass of water and we think that's sufficient. When you go through an ozone session, you must drink a good 2.5 liters of water, because everything that's going on with your liver and kidneys, and as you say, Christine, you know, there are 500 different functions they're doing. So the actual reaction that's going on, you're not feeling it. You may feel a little bit tired, and that's purely a sign that your body is getting to work to repair itself. But then we must eliminate that. And obviously the water is absolutely key.
Yeah. And I've also read that it also suppresses inflammatory responses. So it's actually been seen to be quite protective against neurodegeneration. So things such as Parkinson's and Alzheimer's could be interesting to use in therapy. I have a quick question, Nikki, and that is with regards to how often, because as we all know, too much of something may not be as beneficial as having something in smaller doses. And that's the same, you know, moderate exercise is great, but doing, you know, intense exercise every day isn't so great for us. So what would you suggest for clients? Does it depend on the condition, or?
It depends on the condition and the person. So it depends on several factors. But if you take it as a rule of thumb, what has been clinically proven that someone who does not have a major illness, you are looking at between 5 to 10 sessions to get all your marker points, i.e. your inflammation, your immune system, your central nervous system, your detoxing, etc. To get those into balance, you're looking between 5 and 10. And then after that, it goes down to maintenance, which is simply once a month. So you just pop in for your 30 minutes once a month. I currently, because obviously the summer is coming to an end, and I say that with such joy, knowing my kids are going back to school next week. Mummy's going to have a rest. So it's I've literally every day I've got clients who are saying, I'm flying back in, when can I book in? And because they're feeling it, you know, they've been away for a good month, 6 weeks, some of them 8 weeks, and they're like, I need to get back in the pod. I just feel sluggish, my digestion is slow, I've put on weight, because also being in the pod you can burn up to 600 calories. So all these things which gently do come down the longer it's been since your last session. So it's just to pick you back up, and then, you know, then it goes down to that maintenance.
I would say with regards to those undergoing chemotherapy is not to book their session straight in after their chemo, because obviously they need the chemotherapy to do its work, and then they can work on.
Let's talk about that a little bit, because you've mentioned you have a lot of cancer patients. How does ozone assist in people going through cancer treatment?
Basically, I would say every single client who has been through either clinic, they have had a remarkable change in their energy levels.
And these are patients who are currently going through chemotherapy.
Under chemo, and then if they join us at chemo stage, then they will carry on through, obviously, if they go on to radio as well. It's been a remarkable change for them in their energy levels, and also nausea. It's been alleviated. They just feel brighter mentally. So rather than feeling, as you know, is quite understandable with the severity of things, that they just feel a bit lighter and brighter. It varies. This is the benchmark, but I would say I've had clients who just feel better in themselves. others who are out running 15 kilometers every 2 days in between chemo.
Yeah.
So,
can we just explain just a little bit, maybe Christine, you can explain the basics of chemotherapy is administering toxins that then kill cells.
Yeah.
The theory is kill everything and then your body will build back itself.
Exactly. There's a reason why.
And so then the ozone therapy detoxes the toxins.
Yeah, exactly. There's a reason why women have there's a reason why people have chemotherapy, and that is it is a toxin, it's a poison, and it's designed to kill off the cancer cells. Ozone is the regenerative that's going to help recreate wonderful new cells and help clear the poison from the body. Obviously, if clearing the poison from the body happens too close to the chemo isn't going to be able to work as effectively. So you need a few days, possibly even a week, to allow the chemotherapy to work its magic, even though it's a horrible poison, and then put in the ozone to help rebalance the body, support those natural antioxidants that the body is desperately in need of when you are going through chemotherapy or radiation, which is the glutathione superoxide dismutase. And as Nicky was explaining about the free radicals, there'll be so many free radicals flying around the body and creating damage everywhere. So it's actually putting the brakes on those. And we shouldn't say boosting, but supporting immune health and the resilience of that individual.
And so, Nicky, it just is giving your patients an extra fighting chance to recover.
Absolutely. And, you know, anyone who's come to me, and some people have come saying, I don't know if I should start radiotherapy. And it's obviously every person's individual choice. But what I always try to instill is you've got to choose your own path, but also put something in that is coming from a different angle than the drugs and, you know, unfortunately the poison that has to go in to kill things off. So it's just, and I think it's also a case of people feel that they're taking back a little bit of control. They come for their ozone treatment, and whereas they're on the train with chemo and maybe radio as well, and they have no control. It's just they have to go, they have to do this, they know they're going to feel unwell, but once they come for their ozone, which is of their own choice, they feel better. And that's the big difference.
Yeah. And it's a time for them to relax away from.
Absolutely. And also to just offload. So, you know, just to have a chat about it with someone, you know, who is not maybe in the room in their immediate lives, but someone just to have a chat who's, I've seen it obviously a lot over the last 3.5 years. And also to compare notes. Is this normal, Nicky? I'm feeling this. Well, I haven't heard of that before. I think you should speak to your oncologist about that. And, you know, it's about working in unison.
I was impressed you had mentioned that the person who runs the hospital where a lot of your chemo patients are noticed one of her patients and said, you must be doing ozone because you look really good.
Absolutely. Yes.
So there's actually visible change in people.
She asked my client, are you on ozone? And she was quite flabbergasted and said, how on earth do you know that? She said, because you look well. And she said, I'm starting to see people who are coming through on ozone. There is a difference in your energy levels and just how you look in general. And she completely understood it. She obviously an intelligent lady. And she said, yeah, you're just helping your body to pick itself back up after each session, which is great.
Yeah.
So
my own personal interest, because of being exposed to a very moldy environment a few years ago, and the things that I've been dealing with, just weird background health things that no one can pinpoint. I was really interested in how ozone can help with mold. I don't know if it's called mold poisoning or just mold that you've been exposed to. Is it effective? Is it shown to really help people with that?
Yeah, I mean, it's literally, again, going back to the antiviral, fungal and bacteria. So anything that's in your body that is a free radical, which mold is, whether it be in your lungs or in your cells, again, it's going back to the ability that it's helping your body to actually detox and rejuvenate. So it's actually assisting your body try to rid itself of something that shouldn't be in there. And especially if you are run down, your immune system is a little bit suppressed, then it's not going to necessarily be doing its job effectively. By then supporting your immune system on the way up, you've kind of got, again, this chain reaction that's happening, that is just helping your body to right itself.
Yeah, so a lot of these things actually sit within the cells. So the ozone helps open up the cellular membrane of the cells, so you can actually release the fungus, bacteria, and what have you. So it gets released and then can go into the bloodstream and get out of the body.
And viruses too, they can just hang out in different organs and stuff.
Anything, heavy metals, they want to get right into the center of the cell. And the body will hold on to them unless they get help in actually being able to release these things.
Fascinating.
So I wanted to ask you, Nicky, a little bit about another machine you have in clinic. Because you don't just have the HOCAT, you have something else which helps with sort of muscular issues. Can you explain a little bit about that?
Yeah, so I have a pulse electromagnetic field. So this is a bed that you lay on, and there's a mat that you're laying on, and then I put a mat that's very lightweight over the top of you, and it's basically replicating the Earth's magnetic field. So this again causes a chain reaction in the body, and its uses are far and wide. For example, it does disrupt free radicals in the body. They don't like the resonance, which again goes back to the detox scenario. Also, a lot of, for example, football clubs, tennis clubs, the list goes on, actually have these for two reasons. And I have a lot of clients who are professional athletes who literally run in, lay on the bed for 12 minutes, and then they go off to their tournament or their match or whatever to boost their cells. So I've got one lady who's a professional cyclist, and she'll ride from Monaco, and then on the way back, she will then send me her readings, which are always higher, and she's already cycled here. So it is literally like putting your body into a plug socket and charging you up like you would your mobile phone. So it's working on energy. But what it's also doing is for any breakages, any rips, tears in muscles, cartilage, it is creating an environment of faster healing. And I know for myself, last summer I broke my foot, and a week later I had to be at an event looking rather glamorous. And I went on the machine daily for a week, and by the 7th day I had my foot in heels with very little discomfort. So it's quite a tool. It's something that as I say, whether it be athletes or you've got an injury, or it's literally that you've recovered from cancer, or you have concerns about your health and you're just wanting to aid the detox that you're getting with the ozone, this is actually amplifying it. So it's only 12 minutes. It's very different sensation. It's a bit like a TENS machine. So when you've had backache or you've had any muscular problems, it feels like that electricity stimulating your muscles, and your muscles are jumping.
Yeah, it's kind of that like pulsating.
That's it. Yeah. Exactly.
Yeah.
Yeah.
I obviously need lots of it because I found it quite uncomfortable when I tried.
Well, it works in two ways, because the first way, what it's doing, like people will say, I can actually feel that really in the base of my spine or on my left shoulder. Then we'll have a discussion about it, and it's like, oh yes, I've torn a ligament in my shoulder, or I've always had lower back problems. So it works in a diagnostic way, firstly, to find out where you've got inflammation and blockages in the system. Because if you imagine, the magnetic field is flowing through your body, through your bones. And that's another thing, that it's great for women of a certain age with osteoporosis. It actually increases your bone density. With regular use, the clinical trials that I've seen are really quite mind-blowing. And
this is one of the reasons that NASA was incorporating it with astronauts, correct?
Yeah, they basically, after the first astronaut went into space, he came back and he wasn't too well. And to kind of make it a shorter story, NASA took up the baton to research why he wasn't well when he had all 4 elements. And they came back after a 2-year study, published, and basically said that there's a 5th element, which is the Earth's magnetic field. Everything that in nature is resonating, is vibrating, trees, plants, animals are. Animals see it, feel it. Most of us have lost that ability. And so they realized that we need this to stabilize us, is this resonance. And they actually went back to blueprints of Nikola Tesla, and they found that he had made a machine that didn't blow itself up because the amount of force going through it, of energy, that could deliver the exact resonance of the Earth. And to this day, any space station employees, astronauts, must go on this. So it's if you like, space grade equipment, but used by the average person here on planet Earth.
And what can people look for? What is the name of this if they're looking for?
This is a
PEMF.
Yeah, Pulse Electro-Magnetic Field. So it's called a PEMF. Yeah, exactly that. The one I have is called a Hugo. And there are many reasons, but basically it's one of the original elements that is inside that came from Tesla, which is a coil that enables the energy to come out without damaging the machine. And this is in earlier prototypes, they had lots of problems. When I say earlier, we're talking going back 50, 60, 70 years.
This is really nothing new.
So yeah, this is basically the 8th modality in the clinic, and between the 2 machines, it's an hour's treatment.
And it's great. The mat it's very quick.
Mm-hmm.
It's initially uncomfortable because you're going up to your level of what you can stand. And it was really interesting because when I first laid on it, I couldn't even take it everywhere, all around my torso, my abdomen, everything was just like, and I couldn't even get up to one. But then after a few moments, it subsided, and then you were able to turn it up a little bit more. And then it went to a different part, and then my liver was like really pulsating, and then that got better. Turned it up, and my shoulders were going. It was a fascinating experience, and I felt so much better afterwards.
Good.
Just I didn't have any particular body pains, but I felt really centered. I felt really grounded, and I felt I was able to focus and concentrate more. I wasn't, because oftentimes I'm busy running around and I get distracted and I'm a little bit frazzled. And after this treatment, I really felt like
it centers you. Yeah, absolutely.
And one of the other things I would say to anyone that's listening that has sleep issues, boy, do you sleep well after an ozone treatment. Yeah. Wow.
Yeah. And the ozone treatment that I tried at your clinic was also amazing. And I was not feeling well the day I came in. And I think because I had started a bit of a detox program a week before, and I think that was what was making me just have a lot of aches and pains and a bad headache, and I was really not feeling well. But I think the first 10 minutes of being in the pod, I was feeling overheated. I was feeling a bit like it was a lot. And then after that, my headache cleared. It was amazing. And the next day I felt amazing. I was very impressed.
Good. That's the whole idea.
Yeah. So how can people
and I definitely want to do a series.
Yeah, I've said the same.
There's a lot of ozone treatments out there. Some are like injections, intravenous injections.
Absolutely, yeah. Certainly the USA do favor intravenous injections.
Does that have the same effect?
It has the same efficacy depending on what it's being administered for and the doses. But it's personally just my choice. I wouldn't want to have that treatment, my blood exiting my body and then the ozone mixed in and put back in. Purely, I don't particularly like needles. So having a nice temperate steam pod to sit in for 30 minutes is far more favorable for me.
And non-invasive.
Exactly, completely non-invasive.
Yeah. And I have another quick question, which might be of interest for many listeners out there. Is there a minimum age where individuals could start using ozone?
It's 18, and the reason being is it's actually it's not about the ozone, it's about a juvenile's ability to sweat effectively to regulate their temperature. So it's from that point of view, not that the ozone, it could be dangerous or anything, it's no such thing. So it's just from that perspective of being able to sweat and regulate. And on the PEMF, there is no age limit. There are no known side effects. The only thing that I can't do with that is anyone who has any metal in the body that is non-titanium. Titanium is safe. It's non-titanium, or anyone with pacemakers or hearing aids that are actually within the ear canal, because obviously
metal in the body would be anything from like screws and joints in bones to stents in the heart.
Stents in the heart, that's something
usually titanium, right?
They are, but even with stents in the heart, I would just need a yes from a cardiologist of that client, which I would say 95% so far have given them the green light to go ahead. So it's something that, you know, because I can't assume it's made of titanium. Right. I'd like to think they are, all of them, but yeah, it's something that I would just ask the client just to get a yes from their cardiologist for that. But as far as ages goes, I mean, my daughter goes on it and she's 5 years old, so it's absolutely safe. At the bottom of the website, there are testimonials from people who've had, you know, quite invasive back surgery, to people with just kind of list a few different things.
We talked about your patient with the long COVID. Is there any other kind of disease or ailment that you've had as a patient you've seen incredible results with?
Yeah, with certainly with rheumatoid arthritis, and if you like, all the family of arthritis in there. I've even got some clients who have reduced, and some have even completely stopped their pain medication.
Wow.
And they are able to completely control it through the treatment with ozone. In terms of others,
does that have to do more with inflammation or more of a viral thing?
Yeah. Itis means inflammation, and it increases the anti-inflammatory cytokines. So it's working against the itis, the inflammation in the body.
Because I read that specifically rheumatoid arthritis is more of an autoimmune issue than regular arthritis. I don't know if that's a separate thing, but you said in arthritis in general, you've seen an improvement.
Absolutely. And people who've had some pretty major accidents, I mean, breakages in multiple places, and people who've had chronic back pain, people who've undergone quite invasive back operations, knee, shoulder operations.
And this is improved with the PEMF, Matt, or with the ozone?
With both, because most people, apart from if there's a pacemaker or any electrical elements that I can't put them on, then everyone will use both treatments, because they are actually aiding each other. So the ozone, literally, you're oxygenating your body, and with the PEMF, you are creating energy for your body. So everything is actually being charged up to actually do its job properly, and then the chemical reaction that starts in the body is just sent on its way.
Fabulous.
So how can people get in touch with you, Nicky, to arrange an appointment?
Several ways. The easiest, I'm on social media, Facebook, Instagram, under Riviera Ozone, but also there's the website rivieraozone.com. I'm sure you can put a link with my telephone number, etc. And I have my colleague Jackie Nord, who operates and manages the Antibes clinic. And the Antibes clinic is within Riviera Osteo, which a lot of clients have heard about or know it. And there are 7 therapists there. And then, as I say, I've got my private clinic in Roquefort.
All right.
Wonderful.
Well, thank you, Nikki. It was nice.
You're very
much.
welcome.
Thank you for sharing your wisdom on ozone and how it can
You're
help.
very welcome.
And
Been lovely chatting with you.
Bringing ozone therapy to the south of France, because it's the first.
I look forward to seeing you next week.
Yeah.
All right, thank you. If you like this, make sure that you like and subscribe the video and share it with your friends, because sharing is caring, and it gets the word out for local businesses.